Good day and welcome to the COVID-19 podcast. My name is Enoke Kaumba. This is where we talk anything and everything COVID-19 as well as debunk myth related to the pandemic. Now today I am joined by Charmaine Ngatjiheue. She is the Namibian's COVID-19 correspondent and very, very interesting. When I was at the radio stations, I used to be watching her on other media platforms doing her thing at the COVID briefing with the president. And I must say, it's a small victory for me being with her on the podcast. Good day, Charmaine. How are you doing?
I'm very well, thank you. How are you?
I'm doing okay. I was actually speaking previously. I used to watch you doing the COVID briefing, asking the president questions when I was still with the community radios. And it's an achievement that I'm with you on the podcast. So I would like you to know that.
Thank you.
Okay, preparing for the fourth wave. This is the article that you wrote. What are you speaking at? Maybe can you just get into it?
Okay, in a nutshell, my article was based on a survey conducted by the Namibia Private Practitioners Forum. Basically, the survey focused just on private healthcare providers and private healthcare facilities, but it also touched on public healthcare facilities. One of the things that stood out, and I think why the article is also quite important to have it out there, is the fact that the survey states that a lack of planning and also other various challenges around the provision of quality healthcare were one of the leading contributing factors to the high death rates we recorded during the third wave. And I, like you mentioned, from June, July, we really had high death rates. Places we've spoken as journalists, we've spoken to places like the Karutura Intermediate Hospital, and we spoke to nurses, and the nurses would tell us, for instance, during that third wave or during the thick of the third wave, they would see 12 patients die in a day, and that was quite intense, So the article looked at how prepared are we for the fourth wave. Yes, the focus was the private facilities, but also just in general, how is Namibia preparing for the fourth wave? And it's really pivotal that we really prepare for the fourth wave. I think so. The idea is to look into how both private healthcare facilities and public healthcare facilities, let's say, expanding in terms of in terms of capacity, or just the different buildings, the beds. Do we have enough ventilators? Do we have enough staff, for instance, ready in case the fourth wave is gonna be intense? Yeah.
So if maybe there is a possibility of a fourth wave, which we are going to discuss in the future, do you think we are well prepared for the fourth wave?
I think now preparation has started already. I think preparation has already started even during the third wave. I think government and private hospitals realized how intense the third wave was, and they already started, expanding in terms of beds. Like now I speak on government because I still to this day do not know how prepared private hospitals are. Although there were private healthcare facilities that set up tents and military hospitals to treat COVID-19 patients and so forth. I saw that in Okahanya. I think Chivarongo, I'm not quite sure when I was there, but they are doing those small things. But with the government facilities, the public facilities, government got more extra beds. They also got donations of ventilators here and there. They've been also getting I think vaccines as well. They've just been preparing. We have figures, but I mean it's a lot.
When we were in the third wave, prior to that, people had started getting vaccinated, but there was no seriousness to it. Although there were a number of people that were getting vaccinated, but the number of people that were not were a lot, and this can be attributed to a lot of things, misinformation and people being hesitant because of that misinformation and all of that. But I want to know, do you think if we had a nice vaccination plan at that time, do you think we would have avoided the third wave?
Definitely. Okay, but there was at some point when we were, like I said, in the thick of the third wave, there was a point where people were rushing towards getting vaccinated. We would see long queues, but then later on in testing, but then later on the numbers just went down. Less and less, more and more people decided not to get vaccinated. I think if more people had gotten vaccinated, maybe we could have avoided the number of deaths. Maybe we could have been somewhere in terms of getting closer to herd immunity. But at the same time, I believe vaccination should be a choice. Yeah, but I am pro vaccine. I would advise people to get vaccinated, because if you, as a child, were vaccinated or immunized, then what's the difference with getting this vaccine? But the research is out there. People should read up on the vaccines. People should do their research and then get vaccinated. Yeah.
Okay, so let's get to the fourth wave. We are preparing for the fourth wave. But is there a fourth wave? What chances are there? What is speaking to there being a possibility of a fourth wave? I want you to put into context about vaccination plans, getting vaccinated. And of course, December, there's a winter effect in December. We know our country, that's the time it starts raining. So I also want you to put into context as well. I know you are not an expert, but I want your journalism skills to come into play when you are tackling this question.
The chances are quite high. But I speak from what medical experts have said before, that the fourth wave is definitely coming. And December looks like it. We are still in the third wave. But, I mean, we're seeing the numbers are decreasing. They're not as high as they used to be, the number of deaths. And people are relaxing, Yeah. So because we are so relaxed, we are not wearing our masks. We don't sanitize like we used to. We're just walking around like we don't have COVID-19. The other time I was at an event where someone said, no, we no longer have COVID-19. And I'm like, wow. And he was not wearing his mask. It was at a public event. I was like, no, we still have COVID-19, So because we are so relaxed right now, definitely, but we don't know the rate of infection when it comes to the fourth wave. We don't know how bad it's going to be, because it's like, how it is with a pandemic. You really do not know what to expect. But we are hoping that it's not going to be as bad as the third wave, because the third wave was really, really intense, and we saw so many people die,
Okay, so we're almost running out of time. We have about 3 minutes left. So you are listening to the COVID-19 podcast. Probably brought to you by the Namibian newspaper. My name is Enoke Kaumba, and I'm joined by the Namibian's COVID-19 correspondent, Charmaine Ngatjiheue. And we are talking about the fourth wave. As you've heard, there is a high possibility that we might get into another fourth wave. So please do need to do what you need to do. And COVID-19, as Charmaine says, is here. So if you have any questions, as we always do it, from the radio stations that you are listening to us from, you can just call in, or whatever platform that the presenter or your respective towns have, you can ask your questions through them. I'm sure the presenter there will give you those platforms, and ask your questions to Charmaine. Charmaine will be available if you have a question. I myself only have one last question. Charmaine, what is your message to the public out there in relation to this topic?
Like I said earlier, vaccination is a choice, but I would really, really advise us to get vaccinated, guys. We really need to reach herd immunity by March. We are becoming too relaxed. It's like when we were like getting there in the third wave, and we saw the increasing cases, and people were getting tested, and then they were also getting vaccinated, and now we are relaxed again. So guys, just get vaccinated, but do your research. I do not believe in forced vaccination, but I'm a strong advocate for it. I am fully vaccinated myself. And also, this is gonna sound like a song, but guys, let's wear our masks. Let's sanitize constantly. Let's social distance, and I think even when we go out, we should still really just be careful out there. COVID-19 is still with us, and we do not know how how someone else next to you can handle it if they get it from you.
All right, and on that note, we say goodbye. This has been the COVID-19 podcast. It's been a pleasure. One final podcast is coming up with Mr. Frederico. This project has been an eye-opener for me personally, and I hope it has changed your lives, and I hope it had benefited in you making the right choice as we started this whole thing in January. For me, Enoke, it's been a pleasure. One last podcast is coming up. Bye-bye.